The kidneys are two important organs of the urinary system, located in the posterior part of the abdomen, on the sides of the last thoracic vertebrae and the first lumbar vertebrae. Dark red in color and with a shape reminiscent of a bean, the kidneys are considered real filters of the urinary system, as they remove waste substances produced by the body from the blood, thus producing urine. Keeping your kidneys healthy allows you to reduce the risk of developing various kidney diseases and ensure the correct performance of numerous bodily functions. It is good to remember, however, that the kidneys are organs naturally designed to filter and eliminate waste products from the body. So the idea of having to undergo regular detox procedures is devoid of any scientific basis. To have healthy and clean kidneys, just follow some simple tips. But what are they? Let's go see them. Hydration. At birth, human beings are made up of 80% water, but as the years go by, this percentage tends to decrease, reaching around 50% in the elderly. Water is an essential component for the human body, in particular for renal function, as it regulates the blood filtration process that occurs in the nephrons, the structural and functional units of the kidneys. Drinking a sufficient amount of water allows the kidneys to produce more dilute urine, thus making it easier to eliminate waste substances from the body. According to some epidemiological studies, a greater intake of water is associated with a reduced risk of kidney stones, small stones that form along the urinary tract following the aggregation of the mineral salts contained in the urine. Every glass of water that we drink reduces the risk of kidney stone formation by 13%. Correct hydration, therefore, helps to dilute the concentration of urine, reduce its acidity, and eliminate excess salt, as well as reducing the risk of developing some urinary infections. To understand if you are drinking enough water, look at the color of your urine. If they appear pale yellow in color, they are generally considered normal and indicate a good level of hydration of the body. The greater the water intake, the clearer the urine will become until it appears almost transparent. If, however, they take on a darker color, ranging for example from dark yellow to brown, it could indicate that you are not taking in enough liquids and are therefore dehydrated. The Italian National Institute of Health reminds you to drink at least 2 liters of water a day, especially in the hottest periods or after carrying out intense physical activity, as you lose a greater quantity of liquids and mineral salts. Salt. Obtained from the evaporation of seawater in salt ponds or through rock salt mining. Salt is one of the best known and most used condiments in cuisines around the world, as well as an excellent preservation agent capable of inhibiting bacterial proliferation. According to the result of numerous studies, excessive salt intake causes harmful effects on the body, including kidney damage, hypertension, and cardiovascular health problems. This is because salt, by increasing blood pressure, can damage the blood vessels in the kidneys, particularly the renal glomeruli, a dense network of arterial capillaries that takes care of blood filtration. Furthermore, excessive salt consumption alters the sodium-potassium balance in the body, reducing kidney function and increasing the amount of protein in the urine, which we remember is an important risk factor for declining kidney function. There is also growing evidence that in patients with kidney disease, high salt intake can aggravate symptoms and worsen the course of these conditions. In fact, the World Health Organization recommends consuming less than 5 grams of salt per day, which corresponds to a teaspoon. However, globally, daily salt consumption in the adult population is on average 10.8 grams, more than double the recommended value. The sodium intake in our daily diet is not only represented by the table salt that we add to season our dishes, but also by that present in industrial products. Among the main sources of salt, we find bread and baked products, cured meats, cheeses, salty snacks, and some canned foods. Also pay attention to the condiments used in the kitchen to replace or in addition to salt, such as stock cubes, soy sauce, ketchup, mayonnaise, and mustard. Nutrition. Nutrition plays a crucial role in maintaining the health and well-being of the entire organism, including that of the kidneys, as it helps preserve their functionality. Experts therefore recommend following a healthy and balanced diet, consuming low-sodium foods and focusing on fruit, vegetables, whole grains, and low-fat dairy products. Among the foods particularly suitable for kidney health, we find green leafy vegetables, in particular cauliflower. It is rich in antioxidants, fiber, and vitamins, and has a low content of potassium, sodium, and phosphorus, so much so that it is often included in the diets of people suffering from kidney failure. This is a clinical condition in which the kidneys are no longer able to perform their function correctly, thus favoring the accumulation of waste substances in the blood. Among other kidney-friendly foods, we find blueberries, rich in anthocyanins, grapes, which contain flavonoids, a large class of compounds with antioxidant activity, and finally pineapple, rich in vitamin C and bromelain, an enzyme known for its anti-inflammatory properties. To protect the kidneys, it is important to also limit the intake of sugars, saturated fats, and cholesterol. According to a study published in the journal Frontiers in Nutrition, excessive consumption of added sugars leads to the formation of kidney stones. In people where 25% of their daily calories come from added sugars, the risk of developing kidney stones is up to 88% higher than in people who keep added sugars below 5% of their daily calories. Physical activity. Physical exercise is considered a real medicine and should be an integrating part of a healthy lifestyle at all ages. According to the results of some studies, carrying out moderate physical activity reduces the formation of kidney stones as it decreases the excretion of calcium in the urine. However, it is important to compensate for excessive sweating and therefore the loss of fluids due to physical exercise by increasing water intake, otherwise the opposite effect could be obtained. This is because the crystallization of uric acid and calcium oxalate in the urine could occur and therefore increase the risk of the formation of kidney stones composed of these salts. Physical activity is one of the main prevention strategies for chronic kidney disease, as it improves a number of metabolic factors, including blood pressure, triglyceride and cholesterol levels, and insulin resistance, which in turn should preserve kidney function and reduce the risk of cardiovascular diseases. Smoking, alcohol, and drugs. Smoking and excessive alcohol consumption have a nephrotoxic effect. In fact, they are recognized as two of the main risk factors for both the development of kidney diseases and their progression. This is because they both increase blood pressure and damage blood vessels throughout the body, including those in the kidneys. This vascular damage, in the long run, reduces kidney function and therefore also their ability to filter blood. Quitting smoking and abstaining from consuming alcoholic beverages significantly improves kidney health, and if the damage caused is not particularly serious, your body will try to repair it and therefore heal. The kidneys also play a crucial role in the process of eliminating many drugs from the body, so abuse or incorrect use of medicines could lead to a buildup of metabolites in the kidney tissues, resulting in damage to kidney function. Among the drugs most responsible for kidney damage, we find over-the-counter drugs, that is, that class of medicines that can be purchased freely without a prescription. Among these, we find some antibiotics and non-steroidal anti-inflammatory drugs used for their analgesic, antipyretic, and anti-inflammatory properties. To keep the kidneys healthy, it is therefore important to take any type of medication always according to the instructions provided by the doctor or specialist, avoiding do-it-yourself, which is responsible for numerous side effects and potential damage to organs and systems.